Hi everyone and welcome back to my channel. I'm Jen McKenzie, the breast cancer physio, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this video, I'm going to be talking about who should be in your breast cancer team, because most people would be aware that you should be seeing a breast surgeon once you get diagnosed with breast cancer. You might then go on to a medical oncologist. Then you might go on to a radiation oncologist for radiation treatment and of course chemotherapy with a medical oncologist. Hopefully there's also a person in your team called a breast care nurse, or that's what we call them in Australia, but in other parts of the world they might be referred to as something slightly different like a cancer care nurse or similar. But in this video, I really want to push one major point, which is the fact that in your breast cancer team, there should also be another huge group of health professionals that are helping you get through in the best way possible, and that's allied health professionals. Now, this includes physiotherapists, occupational therapists, exercise physiologists, counsellors, psychologists, women's health physios, and the list goes on. So, without further ado, let's get into this video. But if you do enjoy this content and you would like to see more, then please give this video a big thumbs up, which is just below the video here. Subscribe to my channel, which is the red button down below. Subscription is free and it really helps me make more videos for you guys. And if you like this video, leave a comment in the section below, because I'd love to hear from you and find out what topics around breast cancer you'd like more information on. Okay, so let's get into it. Who should be in your team if you get diagnosed with breast cancer? So firstly, as we've said, it's pretty common and it's very well organized in actual fact that if you get diagnosed, whether you're at your GP clinic or you're at a screening or an imaging clinic that is diagnosing your breast cancer, you pretty quickly get whipped towards a breast surgeon. Now, sometimes people do have what they call adjuvant chemotherapy. So sometimes they'll be having chemo before they'll be having surgery. But essentially, it's very well organized that you see a surgeon, plus or minus a medical oncologist for chemotherapy, plus or minus a radiation oncologist if you're having radiation as well. Then, of course, there's also referral onto plastic surgeons and breast surgeons in the aftermath if you're having breast reconstruction or breast reduction surgery. The other role, of course, under a medical oncologist is if you're going on to have hormone blocking therapy, which is things like tamoxifen or letrozole, which is in the aromatase inhibitor family. So that whole part of breast cancer treatment, super well organized. What seemingly is not well organized is referral onto allied health. And I believe that this should be an absolutely mandatory standard part of breast cancer care. The reason I rant about this topic is because the number of patients that walk into my clinic and are so angry and frustrated that they haven't been referred on to allied health professionals is super common. Now, I really have to make this point because this is probably the most important point in this entire video. I am not saying that a scar pain problem is equatable to the seriousness of breast cancer itself, okay? So if someone's got breast cancer, that absolutely needs a lot of attention. It is a medical condition that is urgent, shall we say, for want of a better word. It needs to be treated, and the medical professionals have done an outstanding job in saving and extending the lives of so many patients. And, you know, the technology just gets better and better all the time. Like the percentage that you've got of surviving breast cancer these days is just continuing to extend, which is so exciting. However, this is my point. We can pat our heads and rub our tummies at the same time. So if someone gets diagnosed with breast cancer and they've had surgery or chemotherapy and or radiation, they still have a lot of side effects that are a direct cause of breast cancer treatment. Scar pain is just an example, and so many women will tend to put up with scar pain after they've had breast cancer. And part of the problem, I feel, is that the medical professionals are not advocating referral onto the appropriate allied health professional either during or after their breast cancer treatment. This video is obviously a little bit geared towards a sequelae of referral, meaning like I'm probably talking about the fact that it's good to get breast cancer patients onto allied health professionals at least after they've gone through surgery, chemo, radiation. But what's even better again is getting referred to allied health professionals during your treatment. As an example, one of the treatment techniques that I'm now being referred patients for is a pre-treatment LDEX baseline score. So what this means is that patients can get a baseline lymphedema index score, which is going to really help in their prevention of lymphedema, because this is a pre-surgical score. So it essentially means that they are being given a lymphedema index score before any lymph nodes have been taken out. Very, very helpful towards prevention of lymphedema. That's just one example of where a referral onto allied health early can really help the patient long term. Now, another important point, because if you're a medical professional that's watching this video and you're thinking, oh, for God's sake, these patients are just freaked out and they're shocked and they just don't have time to get to, physio, when they've just been diagnosed. I would like to argue that point, because it seems to be that if someone gets diagnosed, they can be organised to get to a surgeon, they can be organised to get to a medical oncologist. Then down the track, they get organised to go to a radiation oncologist. They can see a breast care nurse, they can get to their GP. They can also be organised to go and get all the imaging and all the other appointments that occur in the breast cancer sphere once you get diagnosed. But then magically, it seems like a few extra appointments like physiotherapy or exercise is just too overwhelming and costly for the patient. I say that it should be up to the patient to decide whether or not they can cope with anything extra. And I don't even like using the word extra in here, because I don't really feel like it's extra at all at that point in time. And the other thing too is if the patient is very shocked and unsettled from their diagnosis, sure, they may not be able to cope with very much at the moment, but it doesn't mean they shouldn't be referred on to physio as soon as they can cope with that referral on. So that's my main point, is that we can rub our heads and pat our tummies at the same time. We don't have to just focus on one thing. And I can really emphasize the fact that if the advocacy from the medical professionals is not there, then the patient does not know what to do. So I'm all up for patients taking self-responsibility. So if they have the knowledge to get to a physiotherapist for, say, lymphedema prevention or scar tissue treatment, or they have the knowledge that they're probably going to gain weight, so at some point they're going to need to go and see a dietitian to help them with weight loss. If they know that, then they're probably then able to take that self-responsibility on. However, if medical professionals are not advocating their patients to get to allied health professionals, then they can't take that self-responsibility because they don't have the knowledge. So if you're a medical professional, please, please, please advocate allied health professionals and their role in the breast cancer space. Okay, so let's talk about which people should actually be in your team through breast cancer. I really do believe that to get through breast cancer as well as possible, you need a really comprehensive team, and you need a team that you've got good rapport with. In another video, I'll just refer to up here, I called it "How much information do you need to know?" That video is all about, it certainly contains information on second opinions. So one of the issues I find is that because people so often when they get diagnosed with breast cancer have never had breast cancer before, there's not heaps of people that are going through it for a second time. But when you first get diagnosed, you're a complete rookie in this space. So when you get referred to a medical professional or an allied health professional, it doesn't matter, either or here. Sometimes you don't know if the person you're seeing is fantastic or good or substandard. So I do advocate patients to seek a second opinion if they need to. But there's more on second opinions in that video I just sent the link you to. All right, so let's talk about which allied health professionals I would advocate to be in your breast cancer team. Now, I'll just make a quick point here, everybody, that some of these people I'm going to refer to are not necessarily going to be for everybody. So as an example, allied health professional number one that I'm going to mention is a dietitian. The reason I mention a dietitian is because twofold. There's a lot of patients who have a lot of questions about nutrition, as you can imagine, through their breast cancer experience. So one of the things you can do to alleviate myths that are out there in the community and really be confident that you know that you're eating a healthy diet is going to a dietitian, preferably a dietitian that specializes in patients with breast cancer, but you're not always necessarily going to be able to access that person. Keep in mind as well with all of this advice that, you know, the power of the internet has really proven itself through COVID. And even if you can't physically get to a health professional, you might be able to have what we call a telehealth appointment, so an online appointment to get more education. So if you can't access someone locally, you might be able to access them through a telehealth appointment. The other reason I suggest a dietitian, guys, is of course because of weight gain. Weight gain is such a common problem with breast cancer, and again is one of the most under-addressed topics that I see across the board. Women really struggle, particularly if they've had a bilateral mastectomy, so both breasts removed, and then they have to take hormone blockers, which are associated with weight gain. So they end up having a complete shape change. They go from having breasts and relatively flat stomach to no breasts and a tummy, and that is, as you can imagine, quite socially confronting for that patient. So encouraging patients to attend a dietitian to focus on weight loss, to cope with the effects of things like hormone blockers, and even helping things like chemotherapy effects wear off, where, you know, steroids tend to, the use of steroids with chemotherapy tends to retain a lot of fluid. So that's why I recommend seeing a dietitian. Of course, the second allied health professional I'm going to recommend is a physiotherapist. If you've been following my channel for a while, you'll probably know why. But in essence, physiotherapists are going to treat quite a range of things when it comes to side effects of breast cancer treatment. But, you know, to say quite a few of the most common problems we treat would be lymphedema prevention and management, shoulder range of motion, scar tissue, rib cage stiffness and immobility. And then you've also got things like poor balance from peripheral neuropathy. We even treat things like osteoporosis, and this is where physiotherapy and exercise physiology as another allied health profession can sometimes merge a little bit. So physiotherapists and exercise physiologists can do a fair bit of the same work, but an exercise physiologist will tend to just stick to exercise programming and prescription. Now, when it comes to exercise, I absolutely advocate that as much as possible, every breast cancer patient should be doing an exercise program. My next video will probably be on why exercise is so important during breast cancer. But, you know, the main reasons, again, why every single patient who goes through breast cancer should be referred to an exercise physiologist or physio for an exercise program is to cope with the side effects of treatment, which is deconditioning, and deconditioning for muscle mass and bone stock. Particularly if you're going through chemotherapy, you are at twice the normal population risk for getting osteopenia, which is the precursor to osteoporosis, or osteoporosis itself. So this is essentially where your bones become thinner. The other reason exercise, of course, is so important is because of energy levels, so combating the side effects of fatigue. I'll go into more description in another video on why exercise is so important, but certainly as far as who should be in your breast cancer team, an exercise physiologist I think would be right up the top. Another really important health professional that could be a big part of your team would be a women's health physiotherapist. There are a lot of side effects of breast cancer treatment that affect downstairs. Yes, ladies, I mean, you know, things like pelvic floor dysfunction. So there's a lot of people who suffer painful intercourse. The hormone blockers can often cause vaginal dryness and vaginal itchiness. You've got a lot of patients now going for ovary removal and hysterectomy because of the risk of not only uterine cancer if you're taking tamoxifen, but then also if you are trying to suppress estrogen, if you've got an estrogen positive breast cancer, then removing the ovaries is which is a major source of estrogen, is another way you can reduce the estrogen in your body. So a women's health physiotherapist can really educate you and support and assist you around things like hysterectomy or ovary removal. So a women's health physiotherapist is, I believe, such an important player when it comes to breast cancer. And again, sexual health and well-being in breast cancer is still very under-addressed in my opinion. So find your local women's health physiotherapist, and if you have any of those issues, definitely get on to seeing someone like that. one of the most important allied health professionals is a mental health professional. Everyone who's been diagnosed with breast cancer can appreciate that there is a lot of fear, there's a lot of anxiety, there's a lot of stress. And it's not just your own stress, it's stress for your partner, it's stress for your children if you have them, it's stress for people around you. Workplaces can be a stressful thing to go back to after breast cancer. There's so many relationships that get affected when you get diagnosed with breast cancer. And of course the individual themselves who's been diagnosed. So a counsellor and or a psychologist, I believe, are such an important part of the allied health team when it comes to coping with side effects of breast cancer. But again, it's really quite scary how often I find patients have not been referred to counselling or psychology when they've been diagnosed. So if you're listening to all of this information, guys, and you're thinking, crikey, like, well, there's an Aussie word for all of my US followers out there. If you're thinking, geez, I have not been referred to a lot of these people, push your medical professionals for referral to them. And if they don't know who's out there, then certainly start doing some research yourself and ask other breast cancer survivors if they've found anybody in this space that can help. There's another allied health professional called an occupational therapist. Now, often an occupational therapist can also treat lymphedema if they're specially trained. Occupational therapists can also come into the picture if there's difficulties in returning to work. So one of the most under-addressed topics in breast cancer rehab, shall we call it, is this idea that you should just be able to sort of complete your treatment and then have a bit of a break and head back off to work in whatever, occupation you're doing. So sometimes what happens, or often what happens, is that people return to work and really struggle, and that's a mental and a physical struggle. So occupational therapists are just another allied health professional that can potentially make that transition back into the workplace a lot smoother. Another person I'll just mention, of course, is a makeup artist or a tattoo artist, because a lot more women these days are undergoing breast reconstruction after breast cancer treatment. So this can involve nipple tattooing if you've had breast reconstruction, but there's also a big job that makeup artists do, which is, tattooing back on eyeliner and eyebrows. So one of the best things I feel that breast cancer patients can do is make themselves feel good by looking better. We actually have a program in Australia called Look Good, Feel Better. That's a government-run program that teaches women how to apply makeup, put wigs and turbans on to make themselves feel better. I'll put a link in the description bar below to that program, because I think that's a really fantastic program. It's a little bit like fake it till you make it, where you can make yourself look a little bit more presentable, make yourself look good, and it raises the endorphin levels and makes you feel good. So again, if you are undergoing breast reconstruction and you are having nipple reconstruction, or you're needing a nipple tattooed on, then please push your medical professionals to find out who the local tattoo artists are that are doing nipple tattooing. So as you can see, there is a ton of people that you should be able to access if you've got any of those issues. You will be probably listening to this video and going, well, I don't necessarily need all of those people, but then there will be a lot of people going, well, actually, I do need potentially all of those people in my team. And that's my point, is that breast cancer doesn't stop at your last radiation session. A breast cancer team needs to be really comprehensive. And as I said before, if you're a medical professional watching this video, I would love for you to spread the word on the fact that, we really do need to make referral to allied health professionals just standard. It shouldn't be that patients have to come back and sort of question their medical teams going, why haven't I been referred to this person? I've literally got patients who've had 15, 11 years worth of pain following their original breast cancer surgeries, and they've never been referred on to physiotherapy. A shout out though to the medical professionals, and some of which I work with on the Sunshine Coast very closely. And I've got a fantastic group of medical professionals around me that are referring on to allied health all the time. They really do look at the person as a whole, and I do appreciate them. So thank you to those medical professionals who already do refer their patients on to allied health. Thank you so much for watching this video, everyone. I hope you've gained a lot of information from this. If you have any questions on who should be in your breast cancer team, then please leave a comment in the section below. I'll be back here next Tuesday with another video, and I hope you're having a great week wherever you are. I'm Jen McKenzie, the breast cancer physio, and I'll see you next time.